Ever wondered what to do if you get bitten by a spider? Spiders, fascinating creatures that they are, have often been misunderstood and feared. But here's a comforting fact. Most spiders are not venomous. Yes, you heard that right. Most spider bites are harmless and cause nothing more than minor discomfort. However, there are some spider species whose bites can lead to pain, swelling, and in rare cases, more serious health issues. It's essential to know how to identify such bites and react appropriately. Over the next few minutes, we're going to debunk some myths, provide some facts, and equip you with knowledge on how to handle a spider bite. From immediate steps to take, to knowing when it's time to seek medical help, to what you should absolutely avoid doing, we've got it all covered. Let's dive into what you should do if you're bitten by a spider. First things first, it's crucial to clean the bite area. Now, you might be wondering why this is important. Well, cleaning the bite with soap and water helps to prevent infection. It's like closing the door to uninvited guests. You see, bacteria from the spider's fangs can get into the skin, and by cleaning the bite, you're essentially getting rid of these unwanted visitors. Another benefit of washing the area is that it can help to reduce the severity of the symptoms. It's like putting out a small fire before it becomes a wildfire. By cleaning the area, you're reducing the amount of venom that can affect the surrounding tissues. Now let's move on to the next step, which is applying a cold compress to the bite. This is like putting ice on a sprained ankle. The cold from the compress helps to reduce swelling and pain. It does this by slowing down the flow of blood to the area, which can lessen the spread of the venom. It's essential to remember that the compress should be cold, not freezing, as extreme temperatures can cause more harm than good. Finally, it's important to keep the bite area elevated above the level of your heart. This might seem a bit odd, but it's actually a very effective way to reduce swelling. By elevating the area, you're encouraging the flow of blood and lymph fluids away from the bite. Think of it as directing traffic. You're helping to guide the venom away from the heart and towards areas where it can be neutralized and disposed of more efficiently, and there you have it. The initial steps to take after a spider bite: cleaning the bite area, applying a cold compress, and keeping the area elevated. Remember to keep the bite area elevated above the level of your heart. Sometimes a spider bite can cause more serious symptoms. While many spider bites are harmless, there are instances when medical assistance becomes necessary. It's essential to be aware of these situations to ensure proper care and avoid complications. One of the most immediate signs that you might need medical help is an allergic reaction. This can manifest in various ways, but some of the most common symptoms are difficulty breathing, difficulty swallowing, or swelling in the throat. These symptoms can be frightening, and it's crucial to seek medical attention right away if you experience them. Another sign to watch out for is if the bite area doesn't heal within 2 to 3 days. Spider bites, like any other wounds, should start to heal and show signs of improvement within this time frame. If the bite area remains red, swollen, or painful, it's an indication that something isn't quite right. Signs of infection are also a clear signal that you need medical help. If the bite area gets increasingly red, warm to the touch, or starts oozing pus, these are signs of a possible infection. Fever, chills, or shivering might also accompany these symptoms, indicating your body is fighting off an infection. Other severe symptoms that require immediate medical attention include severe pain or cramping, excessive sweating, or a growing wound. These could be signs of a bite from a venomous spider, such as a black widow or a brown recluse, and should be treated as a medical emergency. Remember, it's always better to be safe than sorry. If you're unsure whether a spider bite is serious or not, don't hesitate to seek medical help. It's always better to err on the side of caution when it comes to your health. So, in conclusion, always be aware of the signs of a serious spider bite. Difficulty breathing, difficulty swallowing, swelling in the throat, a bite that doesn't heal within 2 to 3 days, and signs of infection are all indications that you should seek medical help. Always err on the side of caution and seek medical help if you're unsure. You might be tempted to scratch the bite area, but resist the urge. We know how tough it can be, especially when that itch is screaming for attention. But here's the thing, scratching can lead to a world of trouble. It can break the skin, opening up a direct route for germs to waltz right in and cause an infection. And that's just what we don't need after a spider bite. Now let's talk about pressure. You might think applying pressure to the bite is a smart move, like you would do with a normal wound to stop bleeding. However, in the case of a spider bite, this can backfire. Applying pressure can actually help spread the venom faster into your bloodstream. So let's keep the pressure for the tough decisions in life and off our spider bites. Next on our list of don'ts is cutting or sucking the bite area. You might have seen this in movies or heard it as a piece of old wives' tale advice, but it's a big no-no. Cutting the skin around the bite or trying to suck out the venom can not only increase the risk of infection, but also help the venom spread more rapidly. Plus, it's not effective in removing venom anyway. So while it might make for a dramatic scene in a movie, in real life it's best avoided. Remember, the goal here is to minimize the damage, not add to it. By avoiding these actions, you are giving your body the best chance to handle the bite and recover as quickly as possible. It's all about working with your body's natural defenses, not against them. Avoid these actions to prevent further complications. And remember, when in doubt, always seek professional medical help. They're the real experts in dealing with spider bites. Let's recap what we've learned today about dealing with spider bites. Firstly, we talked about the fact that most spiders are not venomous, and their bites are usually harmless. However, it's important to know what to do if you're bitten by a spider, as some can cause pain, swelling, and other health issues. We then discussed the initial steps to take after a spider bite. You should start by cleaning the bite area with soap and water to minimize the risk of infection. Following that, apply a cold compress to the bite to reduce swelling and alleviate pain. It's also recommended to elevate the bite area above the level of your heart to slow the spread of venom, if present. But remember, it's crucial to know when to seek medical help. If you're experiencing symptoms of an allergic reaction such as difficulty breathing, swallowing, or swelling in your throat after a spider bite, get medical assistance immediately. Also, if the bite doesn't improve within 2 to 3 days, becomes infected, or if you start showing signs of infection like fever, chills, or trembling, it's time to consult a healthcare professional. We also covered the things you should avoid doing after a spider bite. Scratching the bite area can increase the risk of infection. Applying pressure to the bite or trying to cut or suck out the venom can cause the venom to spread and increase the risk of infection. These actions should be avoided to prevent further complications. Remember, while these tips are useful, they are not a substitute for professional medical advice. Always consult a healthcare provider if you're unsure or if symptoms persist or worsen. As we wrap up, let's remind ourselves of the key takeaways. Clean the bite, apply a cold compress, and elevate the area. Don't scratch, apply pressure, cut or suck on the bite, and know when to seek medical help. While most spider bites are harmless, it's better to be safe and informed. Stay safe and remember these tips if you ever find yourself dealing with a spider bite.